I've certainly worked with startups in the past who have felt they've got a great champion inside the company and they're impressed with the job title, and they truly believe that interacting with one particular person can build a relationship inside that company, and it never works. It never works. Because there are so many people who have to have buy-in for a project to be accepted.
Oh, that's so true. I was just talking to a young company, a hardware company this week, that's looking for capital from my firm, and they said we'd like to invest, and at the we'll close when we have the strategic deal closed with GE. Right. And I said, well, I'm willing to invest, like, say, in this year, and that deal may take you 20 years by the time we get this done. Not that GE wouldn't be motivated to have that strategic relationship. They may well want it, and I think they do. But they don't move that quickly, frankly, on the business unit side.
No, and I think that's true at all levels inside big companies. I mean, I know what your experience was in going to GE, but, over the last 2 years, I've gone inside of two big companies, Thomson and J&J.
And love to tell about it.
Yeah, exactly. Well, so far. But it's, the number of people you interview with. Yeah. I mean, you interview sort of at that sort of senior level, sort of 15 to 20 people, and decisions. Not everybody is a decision maker, but at the same time they can say no. And everybody you meet, even if they don't seem particularly important, you have to remember that they can probably say no and put a blocker on the deal.
Yeah, that's really true. Yeah. I just started GE in December, so I'm still getting to know the landscape, and it's a massive company, right? 350,000 people, and when you say who's in charge of X, right? You get a list of 14 people back. Yeah. And it's really fascinating. It's hard to think about how and now you're trying to match them up with a small company that has 14 people in it.
Exactly. Exactly. Now, large companies are definitely, they're consensus driven. And the job, if you want to interact and form a partnership with a small company, I think you have to recognize that, and recognize that you're just going to slowly over time build a consensus. And time is the other factor. It's not going to happen overnight. Right. It is going to take a long time, and the rewards can be there, but you can't afford to bank on it and put your own business plan on hold while you negotiate with a big company. Yeah.
What do you think about this whole pilot thing? You see lots of big companies, asking the small companies to pilot their technologies, and what do you think of that?
That's a really tough one, isn't it? I think some degree of pilots are probably necessary in most environments, but we all know about sort of pilot paralysis, where you just get stuck in this endless loop of doing something that the company wants you to do. And the way I always explained it to startups in the past was to say, look, think about, you're here today, you want to get over here. So there's a trajectory which takes you from where for your own business plan, not for the company, the big company, but from where you are to where you want to be. It's kind of a straight line. Now, all startups have to be iterative, they have to change a little bit. So there's probably kind of a cone of opportunity that you want to explore, because you don't exactly know how your business plan is going to work out. But you do want to have bumpers on that. So think about the range of things you want to do yourself in order to get to your end point. Now, when you're working with a company, a bigger company, what I would encourage people to do is actually almost to plot that out and to say what the big company wants me to do fits here. And if it's inside your business plan, your own business plan, then do it. But if they're wanting you to do something which is outside where you want to be as a company, however hard it is and however attractive it can be, don't do it. Turn it down.
Yeah, I agree with that. I mean, I really think all too often the little companies are so excited at the opportunity to have that big name, that they forget how distracting and all-consuming it can be. Right. And sometimes it's actually negative, especially if the pilot is not being paid or if it's not profitable, and it can really, I think, drag a company down. Have you seen good collaborations between the big and the small?
I think I've lived good collaborations between the big and the small. I think in the early days, the first company I ran was a company on the East Coast, and we were just doing too much. The company had actually gone public too early. It was small. I had to downsize it, downscale the business plan, and we did two great deals. One with Cordis, J&J company, and one with Carl Zeiss, and it enabled us to take things off our slate of activities. They really took those things on for us. and came along with investment and so on, and it was really, they were the saving grace for those companies. I've also lived the other side of it, where we've been approached, and I won't name the companies, but when I was at Accuray, approached by companies that wanted us to do this major deal, and it was really, appeared so exciting and so big that we just all got distracted and put ourselves into it, and we spent probably a year, and in the end they just turned around and said, you know what, we've enjoyed working with you, you've decided to go in a different direction. Totally distracting. So I've seen both sides of it, and sometimes it does work out, but very often it's not going to.
Yeah, I haven't seen a lot of good ones. I mean, I've seen tries in logic to these relationships, but by and large, I think when the relationship goes best is when the big company buys the small company and goes all in. Because I think this sort of partnership model between David and Goliath, it gets too out of sync most of the time.
Yeah, I think that's a real risk. I think, and I guess, again, what I'd advise, if it fits with your own business model, then you're kind of de-risking it. But if it doesn't fit, then just don't go there. Mm-hmm. They can work. I mean, I do believe they can work. And I've been on the other side of it as well. I'm on the other side of it now. I mean, looking to invest in small companies. And what I try and do is to put myself into the position of the person running the small company.
But you've been in the position of the person running the small company. So
exactly.
You can.
Right.
But like, I imagine at J&J, just like GE, there's people that say, yeah, hi, I've been here 37 years, No.
Yeah, exactly. Yes, I know. There's a lot of long-termers there, but I think, you're right. I think having been on that side of the fence maybe makes me more sympathetic. Mm-hmm. But I really do, at Samsung as well, tried to do deals that were encouraging and supportive to the company. And I will say, actually, at Samsung, they did have that ethos, whereas like, we're not going to destroy a company, and if we do a deal with a company, we want to see that it's value to them as well.
And was the reason it worked when it did because you separated that out into a different division? I mean, you had the innovation center, and was that where the locus of that energy was? No,
it's a very complicated company. It could have been. It could have been that. But I think that was one of their guiding lights, which was actually a good thing. But looking back into my own sort of positive experiences of working with a big company, I think, I, as the CEO of the company, the small company, set down exactly what I needed. I looked for the companies that could do it, and I then made inroads to them. It wasn't sort of a casual relationship and a sort of like a casual meeting of minds. It was very, very focused. This company's got this. It's something that we want. We really feel we can work with them. Let's now think about why they would want to work with us. Mm-hmm.
Yeah, so what do you think of, there's all these now, especially in healthcare on the hardware side, I'm sure in other industries too, but if you look at the traditional medical device companies or even the traditional EMR type companies, all of them are now trying to become digital companies, right? Mm-hmm, mm-hmm. And they really don't come from that world, trying to go into the cloud, digitize everything they do, monetize data and all that. And the business models make their heads explode.
That's true.
So is there a role there, for the small company to help, or how do they even get there?
Oh, for sure. No, I think definitely. And I think particularly now we're entering a new era where this is obviously a hardware venue. Look, we're entering the era of sort of connected devices and connected hardware. And so not only do you have potentially synergistic hardwares or devices that can take a big company into areas that they're not expert in, but you also have the possibility of connecting them in different ways and providing more of a sort of a global view, global perspective. So my particular interest has been getting kind of a global perspective on somebody's life and applying it to healthcare, which was actually, to be honest, why I went to Samsung. And we built there an IoT platform. And the vision was to bring in all sorts of consumer data. I mean, a wide range of consumer data, because everything has relevance to our health in one way or another. We can read our mood, we can read our stress levels, we can read our sleep patterns, read our diet.
Mood is like a connected mood ring? Is that how you read someone's mood?
Well, no, actually, I mean, so my. And maybe this is extreme, I don't know, but my vision is that probably there are very few devices like a mood ring that will really give you the information that you need. So you need this sort of cumulative cloud of information in order to develop algorithms that you can imply somebody's mood from. So for example, somebody sits down, the music you listen to. Mm-hmm. So you turn on the car radio when you're on your way home. If you're listening to sort of upbeat music, that's an indicator. If you're listening to the news, particularly recently, then if you're not depressed, you're going to going to get depressed pretty soon. So, but you can,
if you're listening to news and then you drive off the cliff, you pretty much know. Yeah,
it's a very good indicator. It's a very good indicator. But I think not to lose sight of the fact that some of these collaborations can actually be data sharing. You know, if you've got a device which is a connected device, that it could be that a new form of collaboration can just be to, you know, share the data that you're generating with different industry partners on the basis that it will generate things which are partially useful.
So let's talk about that. So there's a whole bunch of digital health devices. I mean, you were at a live core.
Yeah.
You know, there's all sorts of things measuring all sorts of parameters, biometric and otherwise. Now, most of these companies struggle, frankly, to come up with a business model that flies. So, but you need all that to do what you just said, right?
Yes.
To come up with your vision, you need that plus other stuff. What's the future for that whole world of hardware?
You know, I'd love to give you the...
Makes me sad that you're laughing.
No, so look, I think there are a number of different aspects to it, and it's something that we could, you know, particularly you and I, we could talk about all day. But we'll focus on the general areas. The first thing is, look, if you're going to make a difference with data, you need a lot of data. And I saw a lot of startups with a vision for the type of data. Look, we're going to collect this sort of data, and we're going to give this type of insight to healthcare. The reality is that step number one, if you want to be a data-driven company, is to have data, and it's very difficult to have data. So there are various strategies that I worked out, certainly when I was at Khosla Ventures and running companies, which is, you know, don't start broad with your vision, start very narrow with your vision, develop a narrow data set, and then try and broaden it out. And you can do that as a small company. A live core was a case in point, where we had sort of ECGs on the mobile phone. An ECG is sort of a heart rhythm. An indicator of how your heart is performing. And you have to think about why would people even contribute that, and how is it going to be useful. But we figured that out, got very good engagement at the patient level, and started to get this narrow data set. Now, the big vision for the company was then to take it from there and say, okay, this person's heart is performing well now, it's not performing well now, what's the difference between the two environments? And that's the second level of challenge for a small company. What is the difference between the context of those two situations? Mm-hmm. And that's where ultimately what decided me to guide myself towards the bigger companies for this era of digital health. Bigger companies have broader access to a broader range of data, and it's the ability to collect context and that broader data set that can actually, I think, provide the ultimate insights to healthcare, if that makes sense.
It does. I mean, you know, it's interesting. We are starting to see big companies, Medtronic's been out in front on this, integrating sensors and technology into their traditional hardware.
Right.
And I think, you know, that's probably, if you look at medical device investing over the last 5 or 6 years, it's been awful. I mean, frankly, you know, you can't give that stuff away right now. And it seems to me that may be the redemption. You know, the way that the medical device opportunity redeems itself is through integration with data and sensors. What do you think? I mean,
I think that's absolutely
you're at the classic job for that right now.
And like I said, I mean, sort of IoT is a solution to that. Mm-hmm. And there's another layer of solution that I think as entrepreneurs in a startup world that you can bring value to the small companies, particularly in healthcare, is engaging in the end customer in a different way. So in healthcare, this is a particularly acute problem. Traditional healthcare companies sell to doctors. Doctors treat the patients. Now, digital health and sort of connected devices operate in the patient world. So to engage directly with those patients is actually a threat to the medical companies, because you're jumping over their customer and engaging with their customer's customer, which can be a real challenge. Now, big companies, you know, sort of Medtronic we know is one, you know, sort of J&J, all of the classic companies in the field, I know GE too, they're very, very interested in the type of information that can come from direct patient engagement. But they're super scared about reaching out and having that engagement themselves. So this is an era where I think that there's real opportunity for smaller companies to focus on things that the bigger companies are struggling with doing, and then bring that value and bring those insights back into the fold.
So the small companies are better at engaging directly with the patient, you think?
Well, they can be, right? But they've got to be careful how they do it.
In what respect?
Well, I mean, I've seen a lot of companies, small startups, and I'm sure you have too, Lisa. I've seen a lot of small companies get it wrong. Even people coming into healthcare, they get it wrong. What they do is they map a doctor's view of the patient onto the patient, rather than talking to the patient themselves. So examples of that would be, actually there are dozens of examples of that, but an example of that would be something like congestive heart failure. And for those of you that are not from a healthcare environment, congestive heart failure is a big problem. Your body basically fills up with fluid as a result of your heart failing. When somebody has that disease, they're brought into hospitals, and the hospitals spend a long time stabilizing them. And if they get that stabilization right, they then send them home. And if they stabilize them well, the patient won't need to come back. If they do have to come back, it's an indication that they haven't stabilized them well, and they can actually end up paying big financial penalties. So the digital health solution, the direct engagement with the patients, is seen as a big opportunity for management of congestive heart failure. Because when the patient leaves the hospital, you can do what's called prevention of readmission of the patient, which would be a big penalty for the hospital, by directly engaging with the patients. Now the challenge is every single one of those, at least you may have seen others, but every single digital health initiative in congestive heart failure fails. Mostly because...
They fill up with fluid?
They do, but mostly because the patients aren't engaged. So that's an example of mapping a medical requirement onto the patient. Now, why aren't the patients engaged? When you take the trouble to sort of survey and interact with those patients think readmission is a really, really good thing. Even though there are league tables of readmission rates, patients will choose hospitals with high readmission rates because they think, well, there's something wrong with me, I want to go back. I don't want the hospital turning me away. So there's a disconnect in the patient's view of the disease and the physician's view of the disease.
But I also think it's, I mean, maybe that's one answer to the survey. The other answer is, I don't want to be engaged. I want to just be a person. I don't want to be a sick person.
Right, so that...
So I think that the engagement aspect of these things, that you expect somebody who's sick or even not sick to engage in their health when they have to, as opposed to when they feel like looking up, calorie content or something.
So this is something I'm really passionate about, and I will say I've spent the last 5 years just focused on that. And what I've realized, and the way I've done this is when I've gone into different startups in different areas, is to, again, focus on patients, as we talked about at the beginning, and get the patient's perspective on their disease. And it's incredible what you find out. So a live call was the first time I got a chance to do this in detail. So these patients have these heart arrhythmias. And they're going to be measuring this on their mobile phones. When you talk to physicians, they say, hey, look, I've done the diagnosis of the patient. I don't want ECGs coming over my text messages and email all the time. I know the patient's got atrial fibrillation. I don't need to be told it every day and just clutter up my inbox with all this stuff. So this really has no value. So we spent a lot of time then talking to the patients. The patient's perspective is, hey, look, when I went and saw the doctor, they told me I had to cut out caffeine, I had to cut out alcohol, I had to avoid stress. What the hell's stress? This process
stress is when you can't drink alcohol.
Exactly. I've got to get a good sleep pattern. How the hell do I get a good sleep pattern, and what is a good sleep pattern? I've got to lose weight, I've got to be more active. How active? I don't know any of this stuff. So the doctor's told me all the things I need to do, but I don't know how to do it, and I don't know how it's going to help me. So the huge patient engagement we got was just enabling the patients to do their own reads after they'd had a cup of coffee, after they'd had a glass of wine, and they are self-experimenting to figure out what they need to do. And I firmly believe now, not all chronic diseases are engaging. Hypertension, for example, is not engaging because people take a tablet and their blood pressure goes down, and after that they've got nothing wrong with them. But most diseases that interact with our daily lives, like diabetes, where people have to be conscious of their diet, where heart disease, where they're asked to change their entire lifestyle, they are incredibly engaging, but you have to see it from the patient's perspective when you think about engagement. You can't just say, I'm going to tell the patient to do what the doctor tells them to do and expect them to do it. That is not engaging, and that's where most of them fail. And that's what I meant about the congestive heart failure example.
But I think the difference in what you're describing is a time difference, right? I think it's when the patient feels an imminent result from the data and the knowledge.
That's true.
That you can perhaps engage them if you're super good at that. And if they think, like with hypertension or diabetes, that the the heart attack or the amputation is 27 years down the line. Call me in 26 and a half years and I'll do something.
No, that's very true. It is. You have to find that if you want to engage people, patients, in sort of management of their own disease, you have to find a point of friction with their lives today. And that's really the point I'm making, that if that point of friction isn't there, like, well, I take a tablet and my blood pressure's fine, you're not going to engage the patient, period. Even if you tell them to take their blood pressure 3 times a day, they're not going to do it. But if you can find a point of friction, that can be the key to engagement.
Yeah, I guess if you do it right, you can find out exactly how much you can drink before the AliveCore registers wrong.
But that's so, and this is. It sounds like a huge data study, and it's been done by a group of nerds, right? So, but with all respect,
I think we're in the right place.
But with all respect to my mother-in-law, who I hope isn't watching the streaming thing, my mother-in-law is sort of in her early 80s. She's very smart, but she's not sort of technical. It's a struggle for her to figure out her iPhone. But at the same time, so she was diagnosed with AFib, and I just gave her an AliveCore system. Didn't tell her how to use it, or showed her how it worked, how the app worked, but didn't tell her how to use it. And spoke to her a couple of weeks later and said, "Hey, Jean, how's your AFib going?" And she said, "Well, I had an episode yesterday afternoon, but I know why it happened. It's because I had coffee with my lunch, and I don't normally do that. I normally have a cup of coffee in the morning." And I hadn't, that whole thesis I laid out to you just now, I had not described to her at all.
Wow.
She just figured that out for herself.
And so does she stop drinking coffee?
In the afternoons. She said, I can have a cup of coffee in the morning, but I can't have coffee in the afternoon. And she still today, I scroll through her ECGs, she uses that thing 3-4 times a day.
Interesting.
Just to figure out the circumstances and try and help herself.
So this really speaks to user-centered design, especially in hardware, well, software too, of course, but I think, what do you think? I mean, is the cell phone a good form factor for healthcare engagement in this realm, or do you need specialty devices, or what?
It's the gold standard, isn't it? I mean,
well, does that mean it's good? I mean, I'm not 80, but I can barely read the damn thing.
Yeah, no, that's definitely true. But I tell you why I think it's good, and why I said it's the gold standard, is because the thing we're going to take everywhere. What else are we going to take everywhere?
Implantable devices.
We're going to wear different clothes every day. We're going to wear, drive different amounts every day, depending on our lifestyles. But wherever we go and whatever we do, for the most part, we're taking our cell phones. People are sitting here in the audience using their cell phones for some reason. Don't know why that would be.
I think they're typing every word we say.
What do you think?
I don't know. I like the argument, right? Everybody's taking it everywhere they go. But yet, we haven't seen any of these digital health companies that make biometric testing, available on the device get very big. They're mostly sort of stuck around $5 million in revenue or worse.
No, that's true.
And I wonder if this is all. I mean, it's different than like a Weight Watchers app where you're, whatever. But I'm really thinking about now hardcore health, medical, technology. Do we have to get to the point where it can be implantable? Like you're going to implant, the heart, whatever, the stent with a sensor in it.
Well, that's one of the things I'm going to be looking at now at J&J, to be honest, because it's an opportunity to put that stuff in. So if I didn't believe that was the case, then I'd be in the wrong location. But I think the reason I feel the phone has got so much importance, I take another company I worked with at Coastal Ventures, Ginger.io, where they're analyzing sort of mental state using the phone. And you start to realize that it's not, similar to the examples I gave earlier on with what music are we listening to on the radio, it's not just our activity that can indicate our mood. It's everything we do. It's the tone of our voice. It's the frequency of interaction. As somebody gets depressed, for example, the general theory is that our cone of activity starts to shrink. So the amount of voice calls we make starts to decrease, the length of voice calls starts to decrease, and ultimately the length of text messages and the number of text messages starts to decrease. So there are metrics you can use there that are not just sort of geolocation and our activities. Sort of what time do we get up for work? Do we arrive at work on time? Are we moving around as much, together with all these other things combined that can really tell a lot in the background about our state of mind. And I think that's an example of something we carry, this supercomputer we carry around in our pocket all day, every day, can be so useful ultimately for healthcare.
Yes, in part, but even that company has not succeeded with that product. They're now turning themselves effectively into a health services company, right? They're saying that's a piece of data and useful, but without matching it up with therapists and the network of providers and becoming a much more traditional health services firm that looks frighteningly like the one I started 27 years ago.
Don't throw business success at me, Lisa. You're sounding like a venture capitalist.
I'm so sorry. I forgot that part about where you make piles of money. But seriously, no, right. I mean, I think a lot of these companies that are really, sensor, hardware devices have not found a way to make money on that alone.
So I'll tell you about that, though. I feel like the healthcare system, to a large extent, isn't ready for that type of service right now. So
it's the system, not the devices.
That's what I feel. Because I know, having been close to them as they went through that first phase, I mean, there were some great deployment examples there, and I won't name the systems, but there were cases where they put their system into the hands of patients on behalf of a hospital system that was running a pilot, and they were detecting potential suicides. In the first week there were like 2 or 3 potential suicides that were detected, and they were able to outreach those patients. The point of friction when it came to a business was digital health tends to save money. So there's no extra budget for this at the hospital system. What they're saying is, sure, you save us money, but saving money doesn't generate a budget. And it's still true today, particularly in the US. We're a revenue-driven healthcare system.
Yeah.
And much as that might change over time, we're still not there. And I think, cost-saving business models are very, very tough. And digital health, till today, for the most part, is a cost-saving business model.
Well, I think the other flip side of that is digital health is not, for the medical device manufacturers, a revenue creation model.
Yeah, it's the same thing.
It's probably a stay in the game, get to parity with other people doing the same thing, or make your device stand out as a competitive advantage. You're integrating data and sensors into it.
So that's a really interesting thing, sort of going into the environment I'm in now, right? So this whole sort of orthopedic space, and I'm
Write this down. It's not going to make your products more expensive.
I'm a neophite when I come to sort of orthopedics. So yeah, exactly. But, I look at it, and the whole industry, and I'm not picking out J&J, the whole industry, quite rightly spending tens, hundreds of $1 million on refining devices inside the sort of established healthcare model. And then when you look at it, the underlying disease most of these devices are designed to deal with is osteoarthritis. And osteoarthritis, like most chronic diseases, is significantly impacted by somebody's weight. Knee implant, knee replacement, for example. If you're above a certain BMI, you're not eligible for a knee implant. So, instant business model. If you can help people lose weight to lower their BMI closer to, say, 35, most doctors will take them on, and therefore a company making knee implant systems will sell more devices. So there are business models you can apply. And then furthermore, after the fact, by helping that person improve their lifestyle, the chances of needing a second knee replacement are significantly reduced.
Which is not that great for a company that sells knee replacements.
Well, but it's a different type of service, because the knee replacements, if you're engaged with a physician, the knee replacement is incredibly complex and hard to manage. So doctors do want to avoid knee replacements. So, I don't know, this is a business model ultimately, I've got to figure it out.
J&J does not want to avoid knee replacements.
Well, any company would if there was a new type of service. So they could say, for example, there's and this is purely speculative, don't take this as a J&J business plan, this is theoretical. But if you were sort of selling a system that included a knee replacement that actually helped the patient recover more strongly after that surgery, why wouldn't you charge a premium? Particularly as we move towards sort of bundle payments, and the avoidance of a repeat procedure is a big business driver for the customers that they're trying to help.
Yeah.
So I think there are opportunities there.
I agree. I think we're starting to see that too, and we're starting to see the device companies, like the drug companies, step up and say they'll take some financial risk for that outcome.
Right.
If they are involved in the recovery and the matching, the monitoring of the recovery period.
And you know what? I mean, you know me well enough. I mean, if there wasn't that type of prospect, then I wouldn't have been attracted to do what I'm doing now.
Have you heard that whole bundle payment thing may be at risk with the new administration?
Yes, well, I don't have the insights there, but if they can get anything done, then maybe. But I think here's the reality. I think we'd go right back to where we started, which is ultimately, I have to believe that even the business model for healthcare will focus down on value to the patients. And I think the underlying things which I think haven't even been challenged by the sort of incoming administration are this focus on outcomes as opposed to revenue.
So how do these traditional med tech companies, like a J&J, like a GE, like a Stryker, like a whoever, Medtronic, how do they traverse into this new world of hardware when they don't employ engineers? They don't employ data people.
What a great segue. So partnerships, right? And that's a great way in. I think we said at the beginning, it's very hard to disrupt yourself, and sort of thinking about where some of these big companies might need to disrupt themselves. And it could be, we focused on sort of the wearable space, but 3D printing is another one. I mean, everything that we experience in our lives is moving into a distributed environment. Distribution channels are changing, and 3D printing is another example of that. Why, if you want really, really personalized devices, which is where we all want to go, 3D printing and distributed manufacturing has got to play a role as well.
Absolutely.
So I think, looking generally, thinking laterally about where a company is today, and even looking at other industries and thinking about where have disruptions occurred, and therefore where might disruption occur in that industry, you can pretty much assume that big companies are already worried about that. They've already got that on their radar. And if you can come in with a solution that says, look, I'm going to work with you to figure out this disruption, and ultimately, to your point earlier, I can be an acquisition target. If I can show how disruptive I can be to your business today, then I could be an acquisition target. I think that's a good driver for relationships.
So 3D printing is a really interesting topic in healthcare. Where do you see the opportunity first?
I think the first is in sort of modified devices, not replacement devices. So, are there parts of systems that are used inside hospitals? And that could be the instruments, the tools. It could be the implants and the replacement, joints and the prosthetics and the things which are tailored to an individual patient. Right now they come in a range of sizes for most procedures, and you know this pretty well. I mean, you go into the operating room, it's usually stacked up with trays, and until they actually open up the patient, they don't really know which particular kit they're going to use, and even which instruments they're going to use. So they have to sterilize everything. There's opportunities there for sort of tailored things to be made. So you don't have to carry the inventory, you don't have to sterilize them, you don't have to put everything into the operating room. You just make one thing that's tailored for that particular patient, and it's exactly what you need.
Yeah, there's a lot of work in imaging going on around how do you image the patient, then you use 3D printing to create the implant or the whatever.
Exactly.
Then you open them up,
Exactly.
It's really amazing.
And that, if you think of the level of cost that's incurred by today's procedures, if you really could change the entire infrastructure, that's disruption of the operating room environment, which is probably the biggest cost center in the hospital.
Absolutely. You could use 3D printing to print business models for these little digital health companies. I don't know.
Yes.
So I wonder, should we take some audience questions, or does anybody out there have any thoughts or questions they'd like to add?
What about the IP issue?
Is there a particular aspect of IP you're interested in?
Yeah, you must have a lot of portfolio, new people coming. How do you develop those?
Well, there are always gaps in IP. Obviously, that's the nature of a startup, is to look for an area, ideally, that is either under-addressed or isn't addressed at all. But in the context, again, of this discussion, I think it's very clear that before you even open up a discussion with a larger company, you should be filing the best patents you can possibly file to make sure you've got a secure corner. Because it's a perfectly viable and common decision for a company to say, we don't need you, we don't need your team, but the IP you filed is a direction we really want to go in, or we want to block other people from going, and that can be the most valuable asset that comes out of that discussion. What do you think, Lisa?
Well, I think it's especially important if you're dealing in the device industry, the medical device industry. I mean, that is the lifeblood of the medical device industry, right? More money's probably been made suing people over patents than actually selling devices, which is not exactly true, but close. But I think it's an interesting time because I think a lot of this stuff is really the confluence of hardware and software. And for the most part, a lot of the software is not patentable, really, in any meaningful way.
Right. Actually, that's a really good point. And I've sort of brought some patents to the front lately that are sort of combinations. So, I mean, that's perfectly patentable concept, which is the thing, okay, this hardware is used in this particular way, but when I use it in this environment with this particular combination, then a new application evolves. To think about, even if you think the hardware itself is sort of unique, is not unique, to think about maybe the combination of things, two pieces of hardware together using the piece of software creates this sort of a new environment. Those things are defensible.
Yeah, I think, by and large, young companies don't spend enough time on this issue. I mean, they don't have enough money often to spend time on this issue, but they often leave it to later. And I think the big companies, it's also, mercenaries, it may be perfectly logical for them to say, well, there's no IP here, so I'll build it myself. Yeah,
and I think it can be seen as distracting. I mean, I know when I started at Accuray, I mean, we had crazy, it was something like only 5 patents, and yet they built this image-guided robotic radiosurgery system, all this incredibly complex technology, and spent millions of dollars on it, but just not focused on the IP. And we certainly corrected that over the years.
Other questions? Gentlemen?
You guys talked about the iPhone or the smartphone, and it seems to be, it's a good tool, but in the medical industry there seems to be that there could be, like you said, it's hard to read. There could be other issues that's getting in the way of a quick adoption. Yeah, everyone carries it, so it's very natural for us to think that would be a natural way to monitor your health condition and all that. And I'm just trying to understand what are the things that's getting in the way. A good point is the readability of the screen. The other thing is people, if they're not that well, maybe the connectivity and getting connected and, just maneuvering the whole thing.
Yeah.
So the ease of use could be another thing. Is privacy an issue? Because now most of the software is residing in the cloud. So now the moment you are exposing your internal condition, connecting it with a cloud-based system, there are companies that's using it. That could be another concern. I just wanted to get your point.
Yeah, there's sort of dozens of answers to that because you went through a number of different things and you've raised some really good points, so thanks for that. I think and Lisa, you mentioned it earlier as well, this sort of readability. One of the challenges I found sort of running companies like AliveCore, where you do need this app interface, is that the people who are developing apps today are not the same demographic as the people using them. I mean, let's be realistic. Most of the people in healthcare who have some sort of health challenge are going to be over the age of 40. Most of the people writing apps are in their early 20s, and they think this looks really cool. Most of the people picking it up over the age of 40 are going to go, "What the hell does it say? I can't read that." So it's sort of designing in an appropriate way for the audience that needs to use it. So that's a basic design thing. There's no reason why text and fonts and information can't be displayed in a way that people can read on a very good high-resolution display like smartphones have. But the other point that's sort of underlying what you said, I think, is that this interaction points out that it's an active interaction that's necessary. And this, I think, particularly in the hardware space, is an opportunity, because ultimately it shouldn't be active, it should be passive.
I agree.
And I think there are huge opportunities for hardware companies to think about passive, connected detectors, as I mentioned earlier on, adding to the volume of information. Maybe they're a complete solution to a particular problem, or maybe they're just bringing in valuable information that could be part of many, many different solutions for many, many different problems. But I think passive data collection, generating data for connected sort of IoT environment is a big area for opportunity.
I agree. I mean, we're also all wearing shoes. So why aren't we using shoes, for measuring certain parameters?
Yeah, you don't wear the same shoes every day. They're very nice shoes, but do you wear them every day?
Thank you. And so are yours. Yeah, but you could put an insert in theoretically, or you could. No,
that's true.
I mean,
that's true.
Yes, you don't wear the same thing every day, but you also put your phone down and pick it up.
It's true. And that is a passive data collection. I mean, just having something in your foot, I would say that's passive data collection, because you're not having to plug information in yourself.
Yeah, so. I think, to your point, I mean, the other challenge, I think, is somewhat generational in that we're at a time when a lot of the people who are in most need of medical services didn't grow up with cell phones, right? And so, you know, if you look out 25 years from now, that will not be true. So it'll be a little different, perhaps. I think actually the privacy issue is a bit of a red herring. I don't think people care so much about that. We're willing to put whatever kind of crap we put on Facebook and Instagram, and, you know, here's a Snapchat of my diabetic wound. God knows what people put out there. And nobody seems to care. I mean, people care from the lawyers care because, you know, they can sue people and make money, and the hackers care. They think they can sell this data, and they apparently do. But nobody seems to care. I mean, I know my data's been stolen out of Anthem. I know it. They told me.
I completely agree.
I couldn't care less.
It's so great to hear you say that, because, you know, I think even in our side of the industry, I think many people share that concern, right? But I completely agree with you. I think it's a red herring. I mean, quite frankly, if you're collecting, as most of the wellness apps are today, I mean, you could be engaged in, you know, sort of even rehab for heart disease. You're counting steps. It's like nobody cares how many steps I did yesterday, other than me. And I really don't care if somebody else sees it. I don't quite frankly care if somebody sees my ECGs either.
Yeah.
I mean, big deal. It's not my bank account.
There are people who care about certain conditions because of employment. Yes. Although now it's illegal, you know, even though it's illegal to discriminate on that basis.
But I don't think that's what either of us are saying, right? It's not that it shouldn't be secure.
Yeah.
It's just that it's not as much of a worry.
It's not as big a barrier, I think, as people think. Mm-hmm. Anyways, we are unfortunately out of time, but thank you so much for your attention, and see you around.
Thank you. Thanks.